Hey guys, so this is Dr. Vince over at FTR in Joliet. Last week we covered the clam exercise and when it's used typically and why it's used. Today we're going to cover the side lying straight leg raise. Again, these are very common exercises that you're going to see in physical therapy. One of the reasons to use this side lying leg raise is if you have a glute med weakness, meaning that your hips are weak. Okay? Usually we'll see a patient will have a little bit of a limp where their pelvis may drop a little bit. You know, every time they take a step, we may see this little hip shake. You know, the hip shake can be okay if it's done purposefully, but in a lot of cases, it may not be done purposefully. So if that's the case, it's possible that there's a weakness there in the hip that we'll need to address, and we can test that, obviously, in physical therapy to see whether or not there's a weakness there. But then we want to address that through a strengthening exercise, or at least a motor control exercise, meaning learning how to utilize that muscle appropriately. And again, when that muscle is weak, it has a correlation with back pain, it has a correlation with knee pain, and it has a correlation with impaired single leg stance times. So we'll cover how to do the exercise real quick, and again, if you have any questions, leave them in the comments below the video. So first, you're going to want to lie on your side. Okay, this part's the easy part, right? You're ready to fall asleep. From here, you're going to raise your leg up. Now, there's a couple of things that we look for when I'm doing this exercise in the clinic with patients. One is, does the pelvis roll back? Okay, if the pelvis rolls back, the muscles that are on the front of your leg are going to start working more so than the muscles that are on the back of your leg. You know, it's a very generic way of looking at it, but this is like meathead terms. I can remember reading this back in the late 1990s as a way to understand which muscles you're working. The muscles that are facing the ceiling are typically the muscles that are working, and so we're trying to get the muscles on the butt region to work, and so we want to make sure that those muscles face the ceiling, and that's going to give you roughly a 30% roll forward. I've seen some people talk about this in courses that you want to roll about 30 degrees forward. It makes sense to me in order to make sure that you're maximizing that muscle's ability to contract against gravity. And then from here, you're going to elevate up. Okay, if you feel this anywhere other than your butt region, you need to make sure there's somebody watching you do this, because that's ideally not what we're looking for. If you're feeling it in the front of the thigh, the easiest thing to say is you're probably rolling your pelvis back. If you're feeling it up here in your back, you may be, I don't know if you can see it on video, but you may be trying to hike your pelvis up, you know, in order to raise your leg. If that muscle is that weak, you're going to substitute with a different muscle way up in your trunk. And again, that's not what we're looking for either. So again, the slight roll forward and elevate the leg. Now, there's a saying out there that you have to master a position before you can move through the position. And so I've seen it in the research to where you would have to hold this for a 1 minute hold, and then after you can do 1 minute holds, then you can start turning this into a dynamic motion. So ideally you should be able to hold this position and just hang out here, and it shouldn't be too difficult for you. If you have any questions, leave them in the comments below. I'll try to answer them. If you have any questions for other exercises that you'd like to see performed, again, leave them in the comments below. Thanks. Have a good day.